When you say One Health, what does that mean?
Well, we define that One Health in the paper as the intersection of animal and human health with that of the environment or surrounding ecosystem in which animals and humans coexist. And so we know that, for instance, with high path AI, we had transmission of the virus from cattle to some of our dairy workers. So everything happens in this environment that includes animals, humans, and where we live. And so the concept seems pretty straightforward in that we have to take all those things into account, essentially animals, humans, and the environment. But the One Health concept is really complex and it reaches across multiple disciplines and getting all those people on the same page is kind of tough. I mean, it requires human health, animal health, ecologists all coming together to find solutions to improve the health of both animals and humans. And I think it's a fairly old concept, but it really hasn't been adopted as well as it could be. And to be honest, when the editor came forward and said, "Hey, would you do a One Health review of H5N1?" This was pretty early in the outbreak. I think we'd had a few human cases. I was pretty naive about what this looks like from a One Health component.
Hello, and welcome to this episode of Dairy Digressions, a podcast of the American Dairy Science Association, the Journal of Dairy Science, and JDS Communications. I'm Matt Lucy, former editor-in-chief of the Journal of Dairy Science and JDS Communications, and fellow of the American Dairy Science Association. I will be your host. Dairy Digressions is where you get an inside look at the science and scientists that are making headlines both inside and outside the dairy industry. We explore the cutting-edge research topics in the production and processing of milk for human consumption. Today, we're talking with Dr. Jason Lombard, who is lead author on a recent invited review in the Journal of Dairy Science entitled The One Health Challenges and Opportunities of the H5N1 Outbreak in Dairy Cattle in the United States. He is one of the point people on the outbreak with respect to collecting and summarizing information on the H5N1 outbreak across the United States and dairy cattle. Dr. Lombard grew up in Colorado and spent his early years on his family's cattle ranch. After obtaining his DVM from CSU, he practiced primarily dairy cattle medicine in Wisconsin for almost 10 years. He returned to CSU and completed a master's degree in epidemiology while working for the USDA National Animal Health Monitoring System. He coordinated multiple national studies primarily focused on the dairy industry. While with USDA, he has participated on an incident management team and was deployed for multiple cattle and poultry diseases during his 20-year federal career. His most recent work has involved investigating bovine TB outbreaks and bovine leukemia virus-associated lymphosarcoma in beef and dairy cattle. These disease investigations and research have taken a One Health approach with collaboration with public health officials and infectious disease physicians. That's a lot. Welcome, Jason.
Hi, Matt. Thank you for the opportunity to visit today and discuss a disease in the dairy industry that has impacted so many dairy cattle producers and dairy workers. It hasn't been the best of times for the dairy industry in the last 18 months or so. I do want to shout out to my co-authors on the paper, Dr. Stenkamp-Strom, McCluskey, Abdul-Hamid, Cardona, Peterson, and Russo, who were really instrumental in bringing that paper together and having so many different perspectives. Otherwise, we wouldn't have been able to put that together. So shout out to the co-authors. I do want to make a note that unfortunately a new herd was detected with high path AI in Nebraska.
Oh my.
Came out in USDA press release. So that's the first in Nebraska. So that'll be 18 states and the first new infected herd detected in more than 30 days. So unfortunately, I think the little bit of reprieve might be over and we'll see what comes of this new herd in Nebraska.
Do you think so? We'll digress. We're going to really dig, but we'll digress. Is that because of the change of the season, or I mean, where the heck Nebraska? That's out in the middle of nowhere. So how the heck does that herd get H5N1?
Well, that's a good question, and there's not a lot of information in the press release, other than it is the B313, which is the predominant genotype that was spreading in dairy cattle for the last 18 months or so,
Yeah.
but no information in terms of where the origin might have been. But we do know that dairy cattle move around a lot in the United States, and it's definitely possible that was associated with a movement. But until the genomics come out, I don't think we'll really have a good idea.
So I have a question, and I am not a veterinarian, and I am not familiar with rules in terms of moving a cow cattle across state lines and that sort of thing. Are all the states shut down right now in terms of moving cattle across state lines, or do you need some sort of approval from the state veterinarian, or how does that work? I'm just wondering if that's in place, a complete total don't move cows across state lines.
No, there are cattle moving across state lines. There are individual state regulations that could be in place. I don't know of any in particular in regards to high path AI, but the federal order that was issued in April of 2024 did require, and that's when USDA has jurisdiction, is in the interstate movement of cattle, not intrastate. They do require testing of lactating cows prior to movement. And it sounds like that's how this herd was detected, was through the federal order testing of individual cows.
Is Nebraska, and this is the first herd in Nebraska then, with the
Right.
test positive. Does there any, did they provide you a location of the herd in Nebraska?
No, it was just came out in a press release in United States Animal Health Association summaries.
So, and we would expect, and we'll talk about in this thing, if it was, I don't know where the herds are located in Nebraska. I'm not sure how closely together, how close they are and all that other stuff, but I guess we'll wait and see if this is located near other dairies and what are the implications for those other dairies nearby.
Right.
Yeah.
And proximity might not be as big a factor necessarily as contact with, movement. If those animals were moving or they had animals that came in from another farm somewhere else.
Mm-hmm.
So yeah, a lot of investigation to be done by USDA in the state of Nebraska on where that originated.
Since you're from Colorado, and would you be involved in those investigations, or is that veterinarians from the state of Nebraska that would do that?
Yeah, that would primarily be USDA and state veterinarians within the state
Yeah.
that has the outbreak.
So back to the paper that you wrote on One Health Challenges and Opportunities. This is a paper in the Journal of Dairy Science. It was recently published. It is open access, so any individual can access it and download the paper and study this paper. It is quite a tour de force. It is a nice paper because it sort of covers the entirety of the outbreak and its implication to other farm species, I think primarily poultry, and then implications for human health. Again, the lead author is Jason Lombard on that one. Do you have publishing plans in the year ahead? Earn serious savings on article charges and put more funds back into your research budget with the Journal of Dairy Science and JDS Communications loyalty program. Reviewers and corresponding authors earn points towards discounted article publishing charges. Visit adsa.org to learn more. And we're gonna just sort of put back a little bit and dissect a little bit your world. First of all, you packed a lot into your young body. Okay, I'm looking at this thing going, there's no way you spent 10 years in private practice, another 20 at USDA. That's 30. Okay, what'd you do? Start working as a vet when you're 16 years old, or how did that all go? I mean, so I'm assuming you're a dairy vet in Wisconsin.
That's where I started. So I'm born and raised in Colorado, as you mentioned, and then decided that I needed to move to where the dairy cattle were, which was Wisconsin, which is a little bit ironic because after I'd been in Wisconsin a little bit, then the cattle started moving further west. And I'm not going to take any credit or blame for that being in Wisconsin. But after a period of time, I just knew that it was probably time to go back home where the family was. And so that really guided our decision to move back to Colorado.
So your degree in epidemiology is from Colorado State then? Yeah.
Yes.
And then your work while you were with USDA, was your workplace in the state of Colorado as well?
Yes, and ironically, the USDA buildings in Fort Collins are on the old CSU dairy pasture. And so I joke because I worked at CSU Dairy when it was a functional dairy as an undergraduate. And essentially, I just went back and working in the same environment I was when I was going to undergrad at Colorado State.
And what was it about epidemiology that you didn't go into mastitis or anything? You went into epidemiology. What was it about epidemiology that you liked or interested you, for example?
Yeah, I think the numbers, I am a numbers guy, but I also like, and I kind of relay this to kind of crime scene investigation type work where you'd go in and you try to figure out what happened, who done it, looking back at some of the diseases we've worked with, whether it's avian influenza in poultry or cattle fever tick or bovine tuberculosis, bovine leukemia virus, and now H5N1 in dairy cattle. There's so many unknowns that it's just exciting to go out and try to uncover and discover new things about those diseases and how they move and so that's really what drove me into epidemiology. And when I was in veterinary school, I did meet with one of my professors and talked about, at some point I'd like to come back and do a master's, but I also had some student debt at the time, and I thought, it'd probably be good to go out and get some debt paid off. And I think they were all surprised that I'd come back after 10 years of being in private practice and move forward with the master's that we talked about earlier. But it was I think a really good move personally and professionally.
What region of Wisconsin were you practicing in? Where were you practicing?
Southeastern Wisconsin. So I was in Mayville and Hartford were the two places where I practiced.
And that was a very different dairy industry back then with smaller herds and tie
Very,
stalls and stuff.
very different. Yeah, tie stalls and yeah, most of the herds we worked with were probably between 50 and 100 head. And
Hmm.
there were a few that were over 1,000, very few, but most of them were fairly small farms.
So this would have been a while ago. What were back in those Wisconsin herds? What were you mostly doing, and what were the dairy farmers mostly talking about relative to their operations? I mean, what was on the mind of those guys back then?
Well, a lot of those small dairy farms were pretty much self-sufficient in terms of they grew most of their own feeds that they could, and they provided most of the labor for their farm. So they were workaholics. Not that there aren't workaholics out there on larger farms, but the 50 to 75 cow farms back then that had one or two people that were pretty much doing everything day in and day out.
Yeah, it's just different, I guess.
Yeah, I talked to one dairy producer and he said, I think he said he hadn't been out of the county in more than 10 years. It just blew me away. I'm like,
Yeah.
I'm like, I don't want to work that hard.
Yeah. Well, so you moved back to CSU, but do you still have an appointment with the USDA? That's one thing I'm curious about.
Technically, I really don't. I am a volunteer at USDA, which means very little, really. But no, I essentially took a leave from USDA and then came to Colorado State. And the nice thing is I can go back and retire from USDA in about a year and a half.
Oh my.
So the timing and everything worked out that I had enough years in and I had reached that age where I could meet those requirements for retirement. So that's a good thing. I really enjoyed my time with at USDA for the most part. I had a lot of great friendships there. I think we did a lot of really good work for the dairy industry through the NOMS national studies that you reported. There just became a time when the door opened to come to Colorado State and I decided to walk through it.
Yeah, it's a great institution, Colorado State. As you know, they've got a great reproductive biology group there, which we think a lot about here at the University of Missouri. We just have a lot of respect for that institution and the things it's done. As you mentioned, I think they did close the CSU dairy. I think that's true.
1989.
Okay, in 1889. Okay, I'm a little behind on that one, but anyway. So you're at CSU, and it sounds like you're a regular faculty member. You mentioned teaching, so you're appointed to. Do you have a clinical responsibility, or what is your cuts or percentages and stuff?
Yeah, so I don't have any clinical responsibility, which is kind of nice because after being out of practice for a number of years, it might be malpractice for me to go back out and do some practice. But my current position is 40% research, 35% service, and then 25% teaching. And the nice thing is that even those are different percentages. For instance, yesterday we went out and we're doing some additional sampling of cattle for high path AI and for bovine leukemia virus. And I had a handful of students with me, so I can actually cover all those bases in a farm visit where I'm doing the research, I'm training students on how to work around cattle safely, collecting samples, and then I'm talking to the producer about what's going on in terms of, right now everybody is getting into corn silage, so that's kind of at the top of the minds of a lot of folks out here.
I know the situation at University of Missouri, for example, is similar to the situation at many colleges of veterinary medicine, difficulty attracting students into large animal clinical practice. Is that also true at Colorado State? Sort of not a lot of kids interested in going into large animal clinical practice, or is that different in Colorado given the nature of the students you have there?
No, I think that's a problem here in terms of the small number of students that are interested in livestock medicine. And I think part of that, what I hear, is that students don't feel like they're exposed early enough in their career, or even before they get into veterinary school, so that they feel comfortable moving toward working with livestock. And so we've got a lot of undergraduates that have helped us over the last 18 months in sampling. And hopefully we've turned some of those students, or if we haven't turned them toward livestock medicine, if they move on to veterinary medicine, at least we've given them a lot of exposure to dairy cattle and they feel comfortable working with them. They know how dairies operate. And I think that's at least the first step in getting more people that want to do that kind of rural vet livestock medicine.
It's interesting. I was just thinking as you spoke about the challenges of a young veterinarian on a large commercial dairy and the complexity of the operation, and also the working with managers that are really at the kind of oftentimes at the cutting edge of the production, all aspects of production, nutrition, health, milk, everything. I thought, it's interesting, isn't it? It's a very interesting field to go into, particularly in the dairy, given the size of the dairies and the amount of money on the line and the skill level. The managers you talk to on these large dairies, they know stuff. They know a lot, and they expect you to know stuff and know a lot. It's interesting, isn't it?
Yeah, I think the dairy industry has progressed so it feels rapid to me, but because I haven't been on dairy farms as frequently as a lot of folks, but I was amazed at and right in your field with some of the reproductive technology and techniques that are being used routinely on dairies now, that when I was in practice, I don't even, those were not even practical to implement yet.
Yeah.
So the dairy industry has progressed a lot, and yes, there are a lot of very intelligent people that are out there managing and working on dairies because they have to. It's a very expensive business to run, and you can't afford to make too many mistakes or you won't be in business any longer.
Maybe it's not fair to say you make money fast, but it's fair to say you lose money fast, really fast. And so
Right.
maybe some of our listeners don't realize that Colorado is I'm not sure in terms of number of cows, but I know the cows in Colorado make a lot of milk. It's a very high production state in terms of milk production. Probably, I guess most of those cows are on the east side of the Rockies, I would guess, out in the flat areas on the east side of the Rockies.
Yeah, so northeastern Colorado, so Weld and Fort Morgan counties. Weld County is one of the largest agricultural counties in the U.S. in terms of total value of products. And so most of our dairies, and there's somewhere between 80 and 90 commercial dairies in Colorado, about 200,000 cows. And that's doubled in terms of cow numbers probably in the last 20 years. And part of that's because of, or probably a big driver of that is Leprino cheese, which has two plants, one in Fort Morgan and one in Greeley. So that's helped drive demand for milk.
I think probably right now, given the price of feed and the price of milk and the price of calves and the price of cull cows, I think these guys are probably making money right now. They're probably doing okay. Is it a good time for them, or are they losing money?
Yeah, I haven't specifically asked, but I think producers seem to be in pretty good moods, especially if you talk about baby calves that are bringing $1,000 to $1,200. The whole beef on dairy phenomenon is alive and well in Colorado. And another thing I've heard that's been interesting is that and most farms in Colorado went through high path AI last year, is
Mm-hmm.
that a lot of them say that the herd has come back and actually producing more than they did prior to high path. So I don't know if it's selective culling of the disease, remove some of the lower producing
Mm-hmm.
cows, or, do they have better cow comfort because they're less crowded? I don't know what the conditions might be, but I've heard that from quite a few of the farmers we've talked to, that production's better than ever.
I think one of the things that people need to understand is that we have a lot of dedicated people in the animal industries that try to do things right, They really do, because you just can't make money in the animal industries if you do things wrong. It doesn't work like that. poorly managed cows or don't make a lot of milk, they also don't make a lot of money, just like poorly managed chickens or poorly managed pigs, or you call it, the animals that are well cared for with the appropriate management strategies, definitely the ones that are profitable. And these guys have their eyes on profit, and so and I think, particularly in the dairy industry, as well as many of these other industries, we do enjoy a good image with consumers, particularly in dairy. I mean, I think people generally feel pretty decent about what we're doing. We can always do things better, but
Exactly.
we're also always looking to do things better. Nobody
Right.
is satisfied, and so and I think the veterinary community is a big part of that. Those guys trained in disease and in management, and I don't know. I always feel pretty good about what's going on, and I'm really proud of our industry. I don't think I could do my job. I know you couldn't do your job if you walked on the dairies every day. And
Right. We can always do better. And like you said, I think the continuous improvement is kind of in place within the dairy industry. Interesting story from last summer. So when we were testing cattle, these are not farms we have necessarily any connection with other than they allowed us to come on farm and sample their cows. And there was a farm that we went on that had some health issues that I saw twice in a week. And I texted the manager and I said, "Hey, you need to address this." And the next time we came out, those problems had been addressed. And I was really proud of that producer for, he could have told me to take a flying leap and get off his farm, but I tried to address it in the nicest way I could. That, hey, you need to take care of this. This is an issue, and he did. And so I think that's dairy producers have a lot of things going on, and sometimes they can miss things, and so they have to rely on their employees and other folks to maybe point some of those things out. And
yeah,
just talking about some of the criticisms of the industry and of the food system in general. Interesting, we were having a conversation in the truck with the students yesterday about this, that, when you have plenty of food on your table, it's easy to criticize where it comes from. And we're very fortunate that we do have plenty of food in the US, and not that we shouldn't criticize and try to make it better, but it can go too far at times too.
hey, I want to ask you about the title of your thing, and I've certainly heard this term "One Health." But what is, if I was a person who really never heard that term before, what to you, how would you explain it to me? What is, when you say One Health, what does that mean?
Well, we define that One Health in the paper as the intersection of animal and human health with that of the environment or surrounding ecosystem in which animals and humans coexist. And so we know that, for instance, with high path AI, we had transmission of the virus from cattle to some of our dairy workers. So everything happens in this environment that includes animals, humans, and where we live. And so the concept seems pretty straightforward in that we have to take all those things into account, essentially animals, humans, and the environment. But the One Health concept is really complex, and it reaches across multiple disciplines, and getting all those people on the same page is kind of tough. I mean, it requires human health, animal health, ecologists all coming together to find solutions to improve the health of both animals and humans. And those, I think it's a fairly old concept, but it really hasn't been adopted as well as it could be. And to be honest, when the editor came forward and said, "Hey, would you do a One Health review of H5N1?" This was pretty early in the outbreak. I think we'd had a few human cases. I was pretty naive about what this looks like from a One Health component. And as we go into the paper with some of the co-authors, when they talk about how this impacted some of the dairy workers' lives and all the personal relationships that were either strained or broken from high path. I mean, I've heard from multiple veterinarians that said, if they mentioned the word on the farm, that they would be asked not to come back to the farm. And so this One Health concept, I think really H5N1 was a really good example of what that could look like. And then the question is, how do we kind of fix some of those things that are broken in terms of relationships, making sure that our employees have the best, personal protective equipment that we can provide, that's actually something that they can use. Yeah, and we'll talk a little bit about that in TB too, because that's something that the One Health concept is applicable as well.
Yeah, so that was something I wanted to ask you about because I think some of your earlier work before H5N1, you worked on tuberculosis and then bovine leukemia. I can I get tuberculosis from a cow?
Yes, you absolutely can get tuberculosis from a cow.
How does that work?
So milk would be one way, and probably the most common way. And there are countries such as areas of Mexico that have a pretty high prevalence of bovine tuberculosis in their dairy cattle populations. And so consuming raw cheeses, raw milk could expose people to tuberculosis. So there's two most common forms of tuberculosis would be Mycobacterium tuberculosis, which causes respiratory problems primarily in humans. And then there's Mycobacterium bovis, which is essentially a cousin of Mycobacterium tuberculosis that causes disease in cattle. And we can spread it back and forth, meaning that cattle can get Mycobacterium tuberculosis and humans can get Mycobacterium bovis. So the primarily route would be through consumption of unpasteurized dairy products from infected cattle.
We have to do TB testing on dairies, for example, and slaughter cows that test positive. Is that correct?
PMO, pasteurized milk ordinance, did have some language in there about testing of dairy herds on a routine basis. I believe Colorado is one of the last states that was doing that. They stopped about, I think, 5 or 7 years ago, where
Hmm.
you had to do some kind of frequent testing. I can't remember if it was annual or every 3 years, where you had to go through and test all the animals in the herd. So I don't know of any state that's doing that anymore. And part of that may be due to just resources and some of the herd sizes that we have now in the US, where, well over 10,000 cows, that's just a huge burden to do that. I think that from a One Health discussion, tuberculosis really falls into there's kind of two issues. The first issue is the bovine TB eradication program, which started in 1917, was really because of the threat to human health. And it's even though it's focused on cattle, it's a human health program. And most of USDA programs are kind of focused on trying to prevent disease in humans. So at the time in 1917, tuberculosis in humans was the leading cause of death by a single infectious agent. Now that could have been Mycobacterium tuberculosis and Mycobacterium bovis. Children were getting tuberculosis through probably the consumption of contaminated raw milk, and almost two-thirds of the cattle that were condemned at slaughter were due to tuberculosis. It was a big problem in the U.S., and there's some really good kind of papers that tell the story of what was going on back then that I can provide to you that are really good reads. And there were, as you could imagine, if approach to tuberculosis has always been depopulation. If we find tuberculosis in a herd, we depopulate that herd. We essentially kill all the animals because it's a difficult disease to detect, and animals can have the disease and potentially be shedding, and we can't find the bacteria. So we've made huge strides in terms of reducing the amount of TB in our livestock populations. And really, eradication should be on the horizon. But we have different routes of introduction now into herds where prior to this, it was really you bought it. You bought a cow that had tuberculosis and they brought it into your herd and spread it to your herd. But that isn't maybe the most common way it's getting into especially dairy herds anymore. And that's why the kind of the second reason it's become a One Health issue is because the recent documentation of human to cattle tuberculosis transmission. So now we started the program to try to prevent human health, so the cattle to human side of the disease. And now we're looking at it where some of our dairy workers actually come from areas with higher prevalence of bovine tuberculosis and are infected compared to our infected cow population. So the pressure's now going the other way, where we're more likely to have an infected worker potentially transmit it to the cattle. And that's been documented in multiple countries. We had two herds and one calf in the United States where we documented that. And one of the things that really gives us opportunity to do that is whole genome sequencing, where we can look at the genetics of that bacteria and determine who was infected first in cases, or the sequences are identical.
Yes. So that's an excellent example of this One Health, isn't it? This concept. I thought you described it so well. Okay, we started out because we had all these cattle infected with tuberculosis. We're trying to protect people, and now all of a sudden it's going the other way. And that's actually that is definitely One Health. That just basically lays it all out there. I think when I thought about H5N1, and I know you know a lot more about sort of the symptoms on the human side of the equation. I was always like, well, humans get it, but it's kind of mild, and that's probably not correct. And I don't know, that's probably an oversimplification, but it's kind of dissecting further or just talking more about H5N1 and the concept of One Health, for example. What I always found sort of startling was, I guess the number, I don't know, 166 million birds have died of just poultry in America. Is that just in America have died from H5N1? Is that it's 166 million. It's a huge number. It's a big number.
Yeah, it is a big number. I've got 175.2 million birds have been depopulated, or the majority of those have been depopulated due to H5N1 since early 2022.
Just as a digression, does that impacted the price of poultry in the supermarkets or the price of eggs? Everybody was on and on about the price of eggs going up. Is that because of H5N1?
That was probably the main reason. That's a lot of birds. And even just when I was with USDA in 2022 and was in Pennsylvania and Wisconsin and Utah, I think I was kind of overseeing the destruction of about 20 million eggs. And that's just a few premises that we were working on over a short period of time. So yes, it definitely has impacted prices. And at least here in Colorado last summer, because we had all of the layer facilities in Colorado were affected primarily through the cattle strain. So we had cattle to poultry transmission. It was not uncommon to go to the grocery store and not have any eggs on the shelves. And I just looked back at egg prices across the US, and the high was actually a few months ago in March at $8 per dozen. And now it looks like it's slightly above $2 a dozen.
Yeah.
It had a big impact.
So that was interesting what you said. I didn't realize, I thought the poultry, I know there was a spillover event into cattle, but I thought the poultry had their own strain, the cows had their strain. But you're telling me that you had poultry flocks with the cow virus.
Right. Yeah, it definitely. And there was multiple states that occurred. And that's actually how I got involved in high path originally, is that there was a transmission from a dairy farm in Michigan to a poultry farm. And so we were asked by USDA to come out and help try to figure out how that occurred. It turns out after a lot of work by the people in Michigan that the poultry farm had a number of employees that were working at the dairy on the weekend. And, 6 months prior to that, you wouldn't have seen that as a risk to either the poultry or the cattle populations, but it's most likely that those employees brought the disease from the dairy back to the poultry farm.
So this is really a great discussion, and I'm glad we're having it because it really is a One Health discussion we're having right now, and this should help our listeners kind of understand the situation. So I've heard it said, and I think you'd probably agree, is once a poultry farmer contacts you that he thinks he has H5N1, by the time you get there, everything's dead. Is that true? Does it happen that fast?
It's not necessarily that fast, but if they once you start seeing birds that are dying, it seems like most of the birds will be dead probably within a week if you just let it go. The USDA kind of plan is to get in there and depopulate, kill those birds as fast as possible once detected, because essentially what you have, if you just let it go, is a bunch of viral factories. The birds are producing virus that's now getting out in the environment and can move potentially to neighboring farms.
So this is a devastating disease. It's lethal. I mean, fair enough.
For
It's
poultry,
lethal.
yes.
It's lethal, not lethal in cows. And we're going to dissect that away a little bit. But does it keep you up at night? The idea, well, guys, we have this thing. It's One Health. It kills a bird, doesn't kill people. But do you lay awake at night going, man, what if the next virus kills people? Do you think about that, or do people think about that?
I've thought a lot about, viruses are going to take us out at some point, maybe. And it's very interesting. I think the when you look at H5N1, which is that's the strain in dairy cattle. If you look at H5N1 in other countries, the people that get that virus, there's about a 50% mortality rate. So if you get
What?
if you
Oh
get
my.
sick with H5N1 in another country, and it has nothing to do with healthcare or anything like that. I don't know what the risks are, but H5N1 in other countries is associated with a 50% mortality. Why is it seemingly a very mild disease in the US compared to other countries? I don't know, unless there's something about once it got into cattle, now it's different. But even when we see H5N1 in poultry in the US, that's been responsible for some human illness as well, but not mortalities like we see in other countries. So similar to poultry, it's a deadly disease. In dairy cattle, does it cause deaths? Yes. Most farms that we've visited did have at least one cow die from the disease. Some had quite a few. It's really variable in terms of the amount of the severity of clinical disease on dairy farms across the states that we've worked with.
I've heard it's in our previous podcast, we talked about swine and how swine can be a mixing vessel. You don't want this thing to get into swine because there's something about swine genetics or something where this virus might recombine and you might get a more pathogenic strain in people. Are we what? I guess I could just ask, how come the pigs don't get it? I mean, could they get it?
They could. So yeah, pigs, as you said, the mixing vessel is kind of the term that's used for that. And because they have receptors for both avian and human influenza A virus. And so they could generate new strains if those two kind of get together. I don't know of any circulating H5N1 virus that's been reported to move from dairy cattle to swine. We have found the genotype D1.2. So the primary genotype in dairy has been B3.13. The swine one was a D1.2, and since then we have found D1.1 in dairy cattle, but we haven't found D1.1 or B313 in swine that I'm aware of. And there is a pretty good swine surveillance system that's out there. Why they've been spared, I don't really know if it's proximity from dairy cattle to swine facilities or how come they've managed to avoid that specific virus.
I know that there was a kind of a backyard herd that they got it, but that didn't seem to move anywhere else beyond that. You get a little bit of that backyard herd stuff going on.
That was the 1.2. Yep.
We're gonna give a little shout out for you. For you, I can already tell we're going to run out of time here, but just for those who want even additional information on this, Dr. Lombard gave a Hordes Dairyman seminar on H5N1, and that came out beginning of September. And it's a very detailed deep dive in a lot of the data behind the current outbreak. Hordes Dairyman is a good friend of the American Dairy Science Association. They always highlight our research. They really take good care of us. So big shout out to Hordes. Big shout out to the Hordes Dairyman webinar. One of our past greats, Mike Hutchins, I think he's still sort of running that thing, And anyway, so there is more information there, and we're gonna go through a few of the topics that you sort of touched on in that Hordes Dairyman webinar, Jason. And one of them was how this thing moves around, the mystery of how this thing moves around. Okay, and so started out, well, it's the milk in the parlor, and it's splashing around, and cows are getting sick, and then it was this, that, the other thing. It sounds like you're a big fan of the aerosol theory. Is that true? Is that your lead theory now, that this thing is basically either the flies or the wind is sort of moving this thing? Can it move around on the wind? Can a windstorm move this? How does a windstorm move a virus? I mean,
That's a that's a good question. We know that some viruses can move in aerosol. So we think about foot and mouth disease virus, and there's others that can move with the wind, kind of in plumes. If you think about poultry facility that's infected with H5N1, high path avian influenza, and all these birds are shedding it, and then we have exhaust fans, they could be pulling all the virus and kind of creating a plume that moves through the air. How this is moving between dairies, I think there are many unknowns associated with that still. And I think we have two that we'd really hang our hats on. One is that we know that moving lactating cows is how it got to almost every state outside of Texas and Kansas. So we know it moved to Michigan through cattle. We know it moved to Ohio, the Dakotas. We know how it got to California. So we know that it moves through lactating cows. The other thing that we're pretty convinced on is move through directly through people. And that ties back to the Michigan investigation where we had the poultry workers that were also working on the dairy farm. Those are the two that I'd say we're pretty darn sure on. But there's a lot of other, it could also move on service personnel. It could move on trucks. Those would be the biggest ones. And we think about milk is the sample that has the highest viral load in it, meaning that's the most risky thing that we're working with. And early on, we heard from quite a few people that, at least from the within herd transmission or moving cow to cow within a farm was primarily through the milking equipment. And talking to a lot of people that know a lot more about mastitis than I do, were under the impression that it was moving way too fast through a herd to be just through contamination of milking units moving from one cow to the other. The other thing that we asked about in those questionnaires from USDA was what is the milking order of the farm, and the disease also didn't move through the milking order, but the milking machine theory kind of held for quite a while. In the meantime, we're looking, and this is a influenza virus. Most of the species that are susceptible get it through aerosol transmission. And so we started working with some collaborators out of Emory University to do air sampling on dairy. So we did that in Colorado. We did a lot of air sampling, and we didn't detect any of the influenza virus. But we were on farms quite late in terms of the outbreak. A lot of times we were 2 to 3 weeks past the onset of clinical signs in the herd at the time we were sampling. So we weren't able to detect it in aerosols. We did also look at milk trucks because we thought, if they're carrying 50,000 pounds of milk that's contaminated with the virus, that's probably a really good opportunity to move it. And not so much the single loads, but the trucks that are going to multiple farms, could they be moving it? And we did sample milk trucks in Michigan and California. Unfortunately, when we got there when we got all the approvals to sample those, it was weeks after the peak of the outbreak in those areas, and we found very little on the trucks. One sample in each of the two states was all that we detected. So we kind of put milk trucks lower on our list of how it's moving between farms. But again, we missed the critical window of peak outbreak in those two states.
You seem to talk about, like, I think it was at Holstein Association, you said, like, yeah, by the time we got to the farm, it had come and gone already. I think this thing moves really fast. Is there ever hope like this? Well, two questions. I think you would agree. This is a fairly fast moving. This was a very fast moving situation. Okay, fair enough. I mean, once it got into certain regions of California, it moved fast. Is there any hope of and this is not a criticism of anybody or anything or any nation or any organization. Can any institution keep up with a virus once it starts? Is it possible to keep up with a viral outbreak in any way, shape, or form to slow it down? Is there any way to respond? I mean, it's like if it was a wildfire, well, you know what to do, right? We got firefighters and they drop their retardant and all the other stuff, but we don't have a viral outbreak like this every year in the dairy industry or every summer. Is there any hope, or is it just like, well, here we go?
Well, this was definitely a learning experience for the dairy industry, right? I mean, we haven't had anything like this in most people's lifetime at this level that are working on it now. And I think that the frustration that I have is not understanding how it moves, because we did have a lot of dairy producers told us that they implemented the biosecurity practices that were recommended, and it didn't matter. They still got the disease. And so that's frustrating to them because they were trying their best to protect their herds, and what we were telling them to do, or what we were telling them were best practices, was not enough to stop this disease. And so that kind of gets to your question about aerosols. because we can't stop air from moving. And how does this virus move in air? And that's the other thing. This whole high path AI in dairy cattle has been a huge puzzle from the beginning, and very difficult to solve. So the disease in Colorado came through in primarily June, July, the heat of the summer. In California, it came through in the late summer of 2024 when they had really hot weather too. But this virus is supposed to be a wimpy virus in terms of heat. That's how we kill it on poultry farms, is we heat the building up to a certain temperature and we let it sit for a few days, and that essentially how we destroy the virus. But this virus moved in dairy cattle during the summer heat very efficiently. And so that doesn't really make a lot of sense from what we thought we would know. We thought that, in the summertime we wouldn't see much of an outbreak. But aerosols, I think, comes up, and we've had some hypotheses on how maybe it's surviving. And being it's in milk, maybe there is transmission that's going on in the parlor, but not necessarily through the contaminated milking machine process. Maybe it's more through the aerosols that are generated in the parlor. And in that milk bubble, essentially, that could be formed, people are thinking that maybe the fat in milk is actually protecting the virus from desiccation in the hot weather. So could those aerosols then move through the air? And I mentioned this on the hordes webinar, that we had 17 farms in California that we'd enrolled with the great assistance of Lander Veterinary Clinic. They were doing daily bulk tank samples, and they were collecting all the bulk tank samples. So the national milk testing strategy in terms of bulk tank is one bulk tank per farm, regardless of what that necessarily represents to the milking herd. But Lander Veterinary Clinic was getting, if that farm shipped 10 loads of milk, they had 10 samples. And they were following these 17 farms. And after a bomb cyclone went through, within 3 days, all 17 farms in a pretty widespread geographic area were detected on bulk tank milk as having the virus. So that kind of got us into even a little more thinking about how is this moving with the air, because it does seem that there's potentially predisposing things that are going on beforehand. So whether it's moving through direct aerosols with like milk fats and bubbles that are moving through the air that are not visible, or whether that's moving flies from farm to farm. I don't know of a fly that would pack its bags and move to another farm if it didn't have to, but if a wind event came through and moved those flies, and they have found that some of these flies have high viral loads that are detectable. So could the flies be transmitting it from farm to farm? And then the peridomestic birds, the starlings, the pigeons, swallows, we see a lot of those on dairy farms. They're difficult to control, just like flies. By the time USDA is able to get out on those farms and do sampling, again, it's 2, 3, 4 weeks after the initial outbreak, and we don't know whether they were responsible for bringing the virus in. Very low percentage, less than 10, maybe even less than 5% of the birds they've sampled have been positive in the peridomestic species. And most of the time, it looks like those are spillovers from the cattle. So we miss the window of determining whether those are a risk or not on dairies.
One of the things that, and again, I keep referring people to the Hordes Dairymen seminar, because you dive into lots of different topics, and there's a lot of graphics there for people to look at. But one of the graphics that really took me back was you showed a cow. And I think one of the lines was her milk production, and the other line was her viral load. And that darn cow got hammered with the virus, and nothing it was a really high viral load, as I remember, and nothing happened to her production. How does that work? I mean, how does a cow get this thing and just like go, oh, well, whatever, Is that normal? Okay, so is that normal in veterinary medicine, or is that just, that happens?
Well, I'm working on another project with foot and mouth disease virus, and we're looking at doing essentially the same kind of screening. Can we look at bulk tank milk to screen for FMD? And what we're learning from the literature there is, yes, we can see cattle that are clinically normal that are infected and shedding foot and mouth disease virus. The slide you refer to from the Hordes Dairyman webinar was an aha moment for me one Saturday morning when I was looking, and because what we find is that the viral load in the bulk tank samples that were being collected is really high. Yet all of the cows that have detectable clinical signs are moved to the hospital pen on most of these farms. And so why does the normal population of cows have really high viral loads in their milk? And there are I don't know the numbers, but there definitely are quite a few cows within a pen that look absolutely normal that can be shedding the high path virus in their milk.
That's why I think now I know why you do the job that you do, because it's really interesting. I mean, if you were, it's not boring, right? You have a
No,
mystery, and
it's not boring.
it's and you dig in. I mean, you're just sort of totally invested in it, and again, I mean, it's interesting because I'm a reproductive biologist, and we study things and we're curious about them, and you're curious. It's curiosity. Your curiosity is disease. Maybe my curiosity is the endometrium, but it's curiosity, right? It's you're curious, like, how does this work? And you're probably like me. You wake up in the middle of the night and you can't sleep, and you're like, you're not really thinking about the Packer game, but what you're thinking about is there's got to be an answer. I mean, it somehow, some way, this has got to follow the natural, the rules of the natural world, whatever they are. Or maybe we don't understand the rules of the natural world, or maybe there are different rules. But how does that happen? It's interesting, isn't it?
Yeah, I say this a lot. I think we know a lot more than we actually know. And not that we make things up, but I think we try to simplify things so that we can understand them. And diseases don't necessarily work that way. Biological systems don't necessarily always work that way. So what we think is unusual, that we have subclinical carriers and shedders of a virus, that that probably happens a lot more frequently. And I haven't looked at a lot of other diseases, but I'm sure that is something that happens. But when you see the impact that this virus had on dairy cattle, it was pretty profound in a lot of herds. And so you wouldn't think that the cow standing there that looks absolutely normal, that's producing 100 pounds of milk and she's chewing her cud, would be infected and shedding the virus.
Yeah, it was interesting. Like, one of my former students manages a dairy in California, and like a lot of dairies, it's got three sites. And I was asking him, well, what was your experience? And he says, well, it depended on what site, which dairy, and it wasn't like every site he managed had the exact 100% identical response to the virus. And that's a little bit about what you're saying. There's some herds that get hit harder than others. I mean, that's fair enough.
Yeah, I think that I'm not sure I've seen two herds that are really closely similar to each other. It seems like they're just a really broad spectrum, from a herd that had, 2, 3% of their cows get sick to farms that had 20, 30% of their cows get sick.
Yeah.
And why trying to tease those apart is a difficult thing to do. And like I say, we've been collecting samples to try to figure out, where cows are shedding, how long they shed. And I'm hoping that once that's all kind of completed, then we can start looking into, okay, well, what are the herd level factors that could have played a role in the severity of disease on the farm?
Are you the only guy in the country that's doing this, or do you have like parallel people in every state that are doing this? Or are you the point person? I mean, you made it onto hordes, okay? So you must be close. Are you the point person nationally? Are you a point person regionally? How is that organized in terms of people working on this and summarizing data? How does that all come together?
So I've got a team that I've been able to assemble here at Colorado State, and luckily I've had quite a few USDA retirees that I worked with for a number of years that I've brought back into into service to help. As far as, there's a lot of people I think working on high path AI, and I don't know, I know some of your other podcasts have had the folks from Cornell on. I know they've been heavily invested. There's other people that are invested, but when you're as busy as we've been over the past 18 months, you lose some of those connections and you don't keep track of what other folks are doing.
Yeah.
We started in Michigan with some folks from Michigan State University, and they've done a lot of good work too, but you kind of lose touch because you kind of get in your own little bubble and you're doing your work. But it is good to go to meetings where you hear new research that's being presented or papers that come out. It's interesting. I've just reviewed two papers, and the one paper, well, one of the things we were looking for is what makes cows at risk for having this disease. And we were thinking, well, it's really weird that we're not seeing it in early lactation animals that should be immunocompromised. We think they'd be more susceptible, but that's not where we're seeing the disease. We're seeing in later lactation cows. And so the question is, does pregnancy make them more susceptible to the virus? One paper said they found it, and the other paper said there was no association with pregnancy. But each of them were looking at one farm, and so I'm hoping we've got 12 herds that we've worked with in Ohio, California, and Colorado that we're hoping to get summarized here in the next couple months. So that kind of speaks back to your variation in what we see from herd to herd. And so reporting on one herd might not be necessarily what 90% of the other herds are observing.
The other slide that stunned me was when you talked about the increase in production in the subsequent year from herds, infected herds. So I'll summarize what you said. The first thing you said was you showed some data. I think you were making the point that there is a certain amount of culling that goes on with a herd that's hit pretty hard. So it's not like all cows go through it. We lose some cows in that. The other thing we know about this, based on some of the challenge studies that I think that was out of USDA, where they were actually challenging cows, is it does damage the mammary gland. I think there's even some scar tissue that formed. It does damage the mammary gland.
Right.
But then you came back in your seminar and you were showing some data in the subsequent lactation. And I think the two questions that always kind of bang around in my mind and bang around in a lot of people's mind is if my herd has had it once, are we going to get it again? And so let's do that first. If my herd I had it last year, am I going to get it again, Jason? Am I going to get it again? What's the answer to that?
It's possible. I think that we've been looking at antibody levels in milk in 6 herds in Colorado, and we're about 15 months out from infection, when they had infection, and we're seeing about 20% of the lactating herd. So we're taking DHI milk samples, we're testing all of those for high path antibodies, and we're seeing about 20% of the lactating herd having antibodies to high path. We talk about herd immunity, and some of the estimates that I've seen say you need somewhere between 85 and 95% of the population to have good immunity in order to prevent a disease outbreak. So our dairies that we're working with, at least, are way below what would be considered threshold for herd immunity. So yes, I think they are at risk if the disease comes back through. And I think that's one reason why we probably need to get vaccination instituted in these herds as soon as it becomes available, at least during the risky parts of the year. And it's not surprising that these herds are down to 20% of the lactating cows having antibodies, because one is they're replacing a third of the herd every year anyway with animals that probably weren't exposed. And the immunity to influenza doesn't last that long. We think about in people we're recommended to get annual vaccinations. So it's not surprising that it's that low, given the turnover of cattle in the dairy industry and the normal duration of antibodies to influenza.
So there's a tremendous amount of research to be done here. So for all you students out there, if you're super bored with your PhD project, maybe you need to think about studying H5N1. And I think the last question before I get to the last question is just that, again, the second element of that was you reported that these cows do pretty well in the next lactation. And I would have predicted the opposite. You probably would have predicted the opposite. Yet you're seeing equivalent or even better production out of those cows. Now I'm sure you adjusted for herd structure. So I guess when I saw that, first of all, I kind of believe it. And I believe it because you said it. Okay. I wouldn't have believed it if you hadn't said it. But then it presents an interesting opportunity. Why? Why would that occur? Why? And maybe there are something we can learn about lactation in general, or how cows go from one lactation to the next in there. Any additional thoughts on that? I mean, how does that work? They make a little more milk if they've had it.
Well, and that's one herd. So that's the caveat. That's one herd that culled pretty heavily. So we need to look at that in more herds than that. So there's two things. One is, I think that the individual cows that had clinical disease, what what are they doing in terms of production? And that's what I presented for that Ohio farm in the Hordes webinar. And that some of that's been written up in a paper out of Cornell as well. The other thing is that at the herd level, what does milk production do? And so the interesting thing about the Ohio herd is when we first went and did that analysis, we were about 5 months after the outbreak. And we looked at milk production. Milk production was down by every parameter in those clinical cows that we looked at. And the producer he said, I'm not really seeing that, as obvious as it is once we started looking at individual cows. And when we went back in January, so that was 7 months after the outbreak, those numbers had completely flipped around and all become positive in every milk parameter that we were looking at. And so I think that one of my hypotheses is that those cows that we looked at in, October, November of 2024 that had gone through disease, those were probably cows that were close to dry off at the time of disease. And maybe they didn't have normal mammary involution, something that prevented them from kind of getting back to where they should in terms of production. We'd expect that the production should go up because they should be moving up to a higher lactation. They're going to be in the next lactation. They should give more milk. So it's kind of surprising that the initial look at that was decreased milk production. But when we went back in January, 7, 8 months after the herd infection, then we saw positive milk production. So there's a lot of things that can happen in a single herd in terms of culling decisions that could impact that. So I'm not going to put a lot of credence into that one herd that had positive milk production. That's great that they saw that. I'd like to see more data from other herds to confirm that those cows are able to, deal with the scar tissue in the mammary gland and produce more milk.
It's definitely if you think about it, it's definitely a researchable topic. And it's a topic that people are going to want to know. They're going to want to know, okay, I just dried off this cow. She had H5N1. If she's pregnant, the price of cows now, pregnant cow, it just, who knows what you do with it. She's probably worth a lot of money no matter what. Okay.
Right.
You can sell her for beef and make a lot of money at this point, so there's tons of work to be done. And I think what you're saying is, and you mentioned this in hordes, is there are vaccines on the horizon and we just got to wait. They need to be tested and made sure they're efficacious and stuff. And is there anything else you want the audience to know or to think about?
Well, I was kind of hoping this disease would be a once in a lifetime and then go away. I think the news today out of Nebraska makes me a little nervous. We have seen and heard, well, we've heard from herds that have kind of gone through what looks to be a chronic infection. And even the herd we were on yesterday, that herd manager said, every once in a while I see a cow that I think maybe she could be the flu. But in Colorado, we're still doing the bulk tank testing, looking not only for the virus but also looking for antibodies, and so they've been negative, and that's good. But I am concerned that we could still have some of these cows that look normal that could shed and infect other cows, and I guess time will tell what that looks like in the long run.
We're just going to have to see, right? And see what happens. But this has been a great podcast for sure, and really articulating very nicely this concept of One Health and why this demonstrates, as well as some other bovine diseases, nicely demonstrate that concept. I definitely want to refer everybody to that Journal of Dairy Science article. So I'll ask you one of our three final questions. If you were not a veterinarian, what would you be doing? And I'm going to guess you'd be like, I'd be cattle ranching or something like that. But do you have something else besides cattle ranching that you always thought about doing? I mean, you've had a pretty stellar veterinary career.
Well, I think I've been really fortunate and blessed, and it seems like, one of the things I've done is tried to surround myself with really smart people because they can carry you a long way, and I've been very fortunate in that. So yeah, I would be involved in livestock and probably the dairy industry at some level. I don't know what that looks like. It is kind of interesting. During the 2014 NOM study, we focused on dairy calves and looked at enrolled calves from pre-weaning to pre-weaned calves from birth to weaning. And I had a crazy idea that, I could raise calves. I think I've learned enough that maybe I could raise calves. And the more I thought about this, the more I realized I don't think I want to work as hard as dairy producers work. And so I want to thank all the dairy producers out there for providing us the broad range of dairy products that are available to us as consumers. And as all my students would say, if there's a place to get ice cream between the campus and where we're going, we'll probably visit it and do a taste test.
It's fantastic. So I'm glad the ice cream tastes so good. It does keep things moving. So that has been great. It's been a great discussion. And again, I know Jason, I know you're super busy with this outbreak as it moves on, but I do appreciate your time. All right, everybody, that brings us to the end of today's show. If you enjoyed Dairy Digressions, be sure to like, subscribe, rate us, and pass the word. If you have feedback, send it to adsa@adsa.org. For show notes and more episodes, go to adsa.org. Until next time, I'd like to say again, thanks, Jason, for taking the time. And thank you, everybody, for listening. Thank you very much. Stay connected with the latest science and the people behind the breakthroughs at the ADSA annual meeting. We're heading to Milwaukee in 2026 from June 21st to 24th. The call for abstracts is officially open. Whether you're a student ready to compete, a researcher with fresh data, or an industry professional, we want to hear from you. Visit adsa.org to learn more and submit your abstract before February 10th, 2026.